Hey, Dr. Brian McKay, Core Health and Darien. I want to talk to you about knee pain. Knee pain, obviously, as a chiropractor, you don't think people are going to come see you for it, but what we have a really good program called the Knee on Track Solution, and it's based on a couple of different unique therapies that I don't know where anybody else can get these therapies around here. I practice in Darien, Connecticut, so we serve Stamford, Darien, Norwalk, New Canaan. Um, So what the program is for people who have chronic knee pain or bad knees, and maybe they've tried surgery. I've had some people go through the program who've had knee replacement, and you think, okay, you get a knee replaced, and finally everything's going to work out like a charm, but it doesn't, and that's kind of where we come in. And so what's typically happening is, okay, you have knee surgery, so they go in, they shave off the meniscus, or you get the knee replaced. What it doesn't do is it doesn't work the muscles that supply and muscles and the nerves that supply the knee. And there's a phenomenal technique called trigenics. And I only started studying it in the past year, but I got to tell you something that's making a tremendous difference. And here's why. Your this well, let's go over a little bit of neurology. There are two nerves in the body. Well, there's many nerves in the body. These two nerves in particular have a connection to and from the brain. One is a muscle spindle cell, and the other one's a Golgi tendon organ. So the muscle spindle cells you would address for a muscle weakness. So when you come in, say you come in to see me for knee pain, right? I have to check. Let's go over just some of the muscles. I got to check the lower back muscles, which is part of the kinetic chain. So you got to start with the back, go all the way down to the toes. So let's touch on a few. We got the multifidus muscle, which are rotators, tiny rotators of the spine. Then you got the quadratus laborum, which is kind of that side support. So if you put your hands on your hips and you feel it push in, that you're on the quadratus lumborum. It's a very big muscle for the lower back. It kind of lets you like lean left and right. Um, Here's else you got to check. You got to check the rectus femoris, which is the large muscle that goes, if you're laying on your back, goes from your hip all the way down to your knee. And you basically have to check that in two different positions. Then you have the vastus medialis, vastus lateralis, which are one's on the inside, one's on the outside of your leg. This is when you're laying on your back. So this is the front part of your leg, your thigh, you would call it, not your hamstrings. Then, in addition to that, you have to check the obturator nerve, the adductors, what muscles that pull your legs together. Those are the inside part of your leg. Um, from there, you also have to check the hamstrings. There's a muscle group called the pes serine. You have to check the popliteus. In some cases, you got to check the tibialis anterior, tibialis posterior, and extensor digitorum longus, peroneus longus, peroneus brevis, flexor digitorum longus, flexor hallucis longus. So there's quite a few muscles that can get dinged up that aren't checked. And what basically you do is you're looking for two different things on the muscles. You're testing for strength. There's no strength. What you have to do is take the body through a normal range of motion. And I'm describing the trigenics treatment here. And then what you do is you take that muscle through a normal range of motion. As the person exhales, they control it, and you make contact with the tendon. Um, Pretty powerful stuff. And then if the muscle's too short, what you have to do is you have to stretch that particular muscle in a certain fashion. So what trigenics does is it identifies muscles that are short, muscles that are weak, or muscles that are short and weak, and then you fix it. And that's where the results come in. And what happens is people just ignore these things. I mean, really, people just typically ignore having having any kind of you know any kind of issues. They just think, okay, uh, I have knee pain. I take an Advil. I take an Aleve. But what happens is the pain's not going to go away, and that's kind of what you really want to do. So basically, we find these muscles, we repair them, either strengthen or lengthen them. Now, that's not the only thing we do. Is we do laser. Cold laser helps tissue regenerate, and it sounds pretty interesting, right? But you need to regenerate cells that are damaged. If you have chronic pain, those cells are damaged. So, you know, basically, we need to address this and get. So we use cold laser, which is a very effective way. In addition, we use the Neon Track, which is a very specialized traction unit that stimulates. uh, production of synovial fluid. Now, synovial fluid is the stuff inside your knee, that liquid, viscous liquid, kind of takes out inflammation in the knee. So it's pretty important, but it stimulates the chondrocytes to produce more. Chondrocytes are the cells in the cartilage, so it stimulates production of chondrocytes. And it also works on producing synovial fluid. So you got a really really cool way of working if you think about it. So my suggestion is, if you have knee pain, give us a call, 203-656-3636. 203-656-3636. And what we'll do is we can set you up an appointment. You come in, and basically, um, it doesn't work for everybody, but it does a pretty damn good job on a lot of cases. If you got chronic knee pain, I have a lady who had both knees replaced, and she's going through the program now. And believe me, can you imagine? She had both knees replaced at age 50, and now she's still in pain. So there's a lot of issues out there that can be helped. It doesn't always have to be surgery. I mean, what are you going to do if you do a knee replacement? Another knee replacement? No, you definitely don't want to go there. So there are alternatives. So using Trigenics, in addition to the neon track solution with cold laser, you have a much better shot at getting that knee pain, back to normal. I'm Dr. Brian McKay, Coilton Darien. I really do enjoy treating knees. It's kind of fun to get people better. So if you have any questions, give us a call, 203-656-3636. All right, take care.